your screen. Okay. I'm not sure.
Okay.
Either that or
Okay, it says I just pressed record and then it says stop recording, so I think it's recording right now. Okay.
Yeah, you're recording.
Okay, thanks. Okay, so this week was related to mental health and public health nursing. So, summary, Mo begins to feel, hold on, sorry, I'm struggling. Okay. Mo begins to feel uneasy and increasingly nervous as his coworkers break out in conversation at the end of a work meeting. A coworker approaches him, asking if he was attending the fundraiser. He mumbles, no. He began to tremble and felt his cheeks getting red. After his coworker responded with, huh? He muttered, I have to go, as he fled the door in a panic with his eyes on the ground. Mo didn't remember the entire car ride home. As he entered his apartment, he collapsed on his chair, felt sweaty and exhausted, as though he was going to vomit. He was short of breath and felt like he was going to have a heart attack. After calming down, Mo tells his brother Ray that he needs to quit his job because of his constant nervousness. He argues that it makes his coworkers laugh at him and he always feels like he's going to pass out while he's there. Ray questions Mo, why are you so nervous and how long have you been feeling this way? To which Mo responds, I don't know, and I don't know how long, maybe months, stating that his mind always goes blank and that he is likely going to be fired because of his nervous behavior. Ray convinces Mo to seek medical help before making the decision to quit. Mo agrees to this, but he gets overwhelmed when Ray says that he will try to get him in to see the doctor this week. Ray assures Mo, if you're this stressed, why would you wait? I'm going to call first thing tomorrow. So the questions for like this first part was that I think we should all discuss is, did Mo's brother Ray act in his brother's best interest? And is Mo's opinion of his colleagues' reactions to his like nervous behaviors actually accurate?
I think his brother has the best intentions, that he wants to get him help and to do it sooner rather than later so the condition doesn't get worse.
Yeah, I agree. I think it was definitely in his best interest. I mean, maybe not like throwing me like, oh, you can go like tomorrow. Like that might even like make him more anxious about it. But definitely like maybe he could have said it in like a different way. But definitely, I think his brother was definitely thinking about his best interest in that sense.
Yeah, and especially since he was going like close to making such a rash decision, like quitting, like
Right.
his job, that could be like a permanent decision.
Yeah, I think that we often think that people like know what we're thinking on the inside, so we might like seem like he might not appear really anxious. So I think that to assume that your colleagues think that you are like dumb and crazy and stuff like that, it's hard not to do that. But I think like often we think too much about ourselves and less about what other people actually aren't thinking about us.
Mm-hmm.
Yeah, I agree with that.
Yeah, I would say I definitely think that he is putting too much emphasis on what he thinks that his coworkers are thinking, but realistically, like if he is having nervous or anxiety or anything, it's easy to do that. And then in terms of his brother, I do think he's acted in the best interest. I do think to some extent you have to let Mo also decide that he's ready to go and see treatment because if he doesn't actually want to do it and he doesn't feel committed to it, then he won't, and it basically backfires. But I do think at least the suggestion is nice for his brother to want that for him.
Yeah, that's a good point. I agree with all you. Okay. Next part of the summary, visiting the doctor. So Mo meets with Dr. Abbott. He gives him a background on his struggles with social situations, asking the doctor, am I crazy? Doctor assures Mo that he is not crazy and refers him to Dr. Tolgan, who specializes in anxiety disorders. Mo responds, okay, as long as I'm not crazy. Mo meets with Dr. Tolgan over the course of a few weeks where they discuss his backgrounds, thoughts, and feelings. The doctor completes The doctor completes a full analysis of his family history, health history, and Mo receives a physical exam and several psych exams. Due to his family history of mental illness, Dr. Tolgan asked for Mo's permission to test for the CACNA1C gene. She requested a genetic counselor to be present to go over the test in greater detail with Mo, including the associated risks and benefits and available treatment options if he receives a possible result. So basically, this gene is usually, as she presents it, linked to different severe diseases and like just like major depression. So it could be linked to major depression, schizophrenia, stuff like that. So then based off all exam results and the negative gene results, Mo was diagnosed with social anxiety disorder. The doctor states, "I would like to talk about some treatment options. How does that sound to you?" Mo replies, "It sounds good. I can't let this anxiety continue to ruin my life." The doctor then states, "It's also a good sign that your answers on one of the surveys indicate that you don't appear to have clinical depression. Anxiety and severe debilitating depression often occur together, but for you, the issue is social anxiety, not depression. That'll likely make it easier to treat your anxiety. So let's talk about some treatment options." So the questions in response to this part of the summary: was Dr. Tolgan's response to genetic testing appropriate in this situation? Could it have been phrased differently? Why or why not? Was Mo receptive to her suggestions for treatment based on how he responded? And were any lines blurred between the patient and provider? Just based off this summary information. And we can go back at the end and like discuss this more as we go more deeper into the info.
I mean, I think that like she brought up the genetic testing in like an appropriate way. Like I don't think she like forced him into it or anything like that. She like obviously asked him if he wanted to do it, and he was clearly okay with it. So I don't really think there was an issue there. And he seemed pretty receptive to like the treatment suggestions. Like he seemed like he wanted to get help. He didn't really want the anxiety anymore. And like with social anxiety disorder, like I feel like it's an easier, obviously, issue to deal with. And then the third one, I mean, I personally didn't really think so, but maybe I'm just like missing something about like patient and provider lines blurred, but I don't know, maybe you guys have some insight on that, but.
Yeah, I thought the same thing when I read through this. I'm like, okay, like I don't really see, like I feel like she did like a good job. I don't know. And then like the more I reread it, just based off his responses, like him overall like repetitively just stating like, as long as I'm not crazy, like if I'm not crazy, like just over and over, and he wasn't really like demonstrating he was really understanding what she was saying and stuff. That's the part where I was like, okay, maybe that could have been like a little iffy on her part. She didn't really ensure that he was understanding. So that's how I looked at it once I was rereading through it, but I had the same thoughts like the first time I read through it as you.
That makes sense.
Yeah, I would say I didn't think anything was really off there. The only thing that I guess maybe I didn't feel like was as necessary was how much description she went into about the depression aspect if it wasn't there.
Yeah.
It's like focus on what his problem is so that you can treat that versus like continuing to mention, oh well, you didn't have it on the survey that you had depression, so we don't have to deal with that, which who knows if that could be something that changes, at least based on what I know about anxiety. So
Yeah, I thought the same thing. Like just because based off his survey results, it doesn't show on paper that like he's not depressed. It should have just been kind of like more investigated, like, oh, do you have depressed feelings? Not just jumping to the conclusion that he doesn't, like talking through it with him.
I think one thing maybe she missed is talking about if the results were positive with the genetic testing, like what would that look like for him and how would he handle that? And I think that discussion prior to the testing would be an important piece.
Yeah, I agree.
I agree with what everyone says. I do think it's interesting that, or not interesting, but I thought it was good that the doctor included a genetic counselor in case there was something that had a genetic component, that they had that available to him if he needed it.
Okay, so this I just kind of put like an overall summary of like the basics like of the ethical dilemmas that I came up with just reading through it. So right to autonomy was a big one. I didn't really write a lot about it on this slide because I go into it after, but like whether or not Mo was competent to give informed consent based off of just his mental state. At first, like it overall like seems like everything was completely like fine in my opinion, but then as I was reading through it, just his responses he was giving, he wasn't straight up showing that he was fully understanding everything. Just parts of the story before, how he said he didn't remember his whole car ride home. Like there just could have been like a lot he was missing, and he was kind of just answering based on the facts that he wanted the doctor to tell him that he wasn't crazy. And then, did the doctor act in the best interest of the patient? Did the doctor serve as an advocate for this patient? I thought that both doctors served as good advocates. The first doctor who referred him to someone who specializes in anxiety, so he was getting the most accurate, best care. And then Dr. Tolgan, who completed a full health and family history. She worked out all the potential possibilities and narrowed it down to a single diagnosis. So I thought they both did a really good job advocating. And then in terms of justice, which obviously I'll get into later, just the point of like the stigma that revolves around mental illness, and if there was any biases in terms of Mo's care, like if Mo wasn't a psych patient, would the doctor have handled the situation differently? Would she have communicated with him differently? All that. Okay. And then, so medical implications. So just a quick overview of social anxiety disorder. It's the most commonly diagnosed form of anxiety, which they do mention in the case study too. Those with SAD experience intense feelings of anxiety in response to social interactions. As a result, individuals will avoid putting themselves into social situations. So Mo demonstrated this by, he didn't want to, when the coworker asked if he was attending the fundraiser, he wasn't going and he freaked out about it. He demonstrates self-consciousness and constant worry by wanting to quit his job because he believes that he's going to be fired anyway because of his behaviors and the fact he feels his coworkers are constantly laughing at him. And then additionally, his constant questioning of whether or not he's crazy and stating that he isn't crazy. Some psychiatric disorders, such as schizophrenia, are highly genetically linked. Due to Mo's family history of his uncle having schizophrenia, the doctor wanted to test him for the CACNA1C gene, which is linked to disorders like major depression, bipolar and schizophrenia. So this testing would be beneficial for Mo because it would show whether or not he has predisposed risk of mental health implications. As previously stated, psych disorders are genetically linked, and knowing the presence or absence of this could be a key component of the diagnosis. Failing to test for it could lead to an inaccurate or misdiagnosis, which in the end may harm the patient due to improper treatment. So patient preferences deals with respect to autonomy. Respecting a patient's autonomy includes obtaining informed consent for treatment, allowing patients to refuse treatments, disclosing comprehensive and truthful information. We all know that. So the doctor asked permission for Mo to test for the gene, explained why they wanted to test for it, and requested for a genetic counselor to be present in order to go into greater detail, talking about risks and benefits and available treatment options if he receives a potential result. All of this fulfilled his right to autonomy. However, it can be argued that the doctor failed to test for competency. So this kind of relates to like Tessa's from last week, whether like was the patient competent or not, and like how do you go about really like seeing if they are. And so overall, based off Mo's social anxiety, his demonstrated behaviors through like the case study and his responses to his compulsive responses to the doctor make it questionable as to whether he was giving proper informed consent on the genetic testing. Mo didn't show full understanding of what the physician was communicating to him. Patients with psych disorders, especially Those that impact memory and attention span often do not fulfill the understanding aspect of the capacity evaluation. In most cases, we saw earlier that he did not remember his entire car ride home from work. He also had trouble recalling how long he was experiencing his anxiety. Additionally, he constantly describes himself inside his own head. These behaviors, along with the simple fact that Mo did not verbally express his understanding of the genetic testing, collectively indicate that he does not fulfill this part of the evaluation. And then this is just some information from some additional information from the book. Well, like what I have on the slide: communicating a choice, understanding, appreciation, and rationalization / reasoning. These are all part of the evaluation that's important to decide whether or not a patient is competent to make their own decisions. And then down here, another set presented by Brody that is kind of specifically applicable for psych patients. So things like the ability to receive information from surroundings, to make a decision and give reason for it, to use relevant information in making the decision. And so basically, Mo kind of just overall was like, yep, do it. Yeah, that's good. As long as I'm not crazy. He didn't really like straight up. The doctor wasn't like, do you want to go on with the genetic testing or do you want to this? The doctor like verbalized it as, does that sound good to you? Does this sound good to you? Like that kind of communication. And he kind of was just like, yep. So does like this information like presented in the slide change any of your opinions or like make you see it any different than how you originally saw it?
I think maybe just like getting that clear like yes or no answer and like elaborating on it might help a little bit, but it's hard to say without knowing more information.
Yeah, I think that definitely more information would be helpful. It's hard also to know, like, without seeing, you know, the general appearance of the patient. Obviously, he was going through a lot in the time before seeing the doctor. So I think if she was able to make it more of a conversation versus kind of saying, like, this is what, you know, we want to do. Yes, yeah, like basically kind of just letting him continue to agree just because he wanted to make sure he's not crazy.
Mm-hmm. Yeah, and like just having kind of just investigating his knowledge, like, oh, could you like, so like they met several times over the course of a few weeks. So like maybe at the beginning of like one of their sessions, like, oh, could you give me an overview of what we talked about last week? And like just that sort of therapeutic communication that we're taught as nurses.
Me, it seemed like he was more focused on what other people may be thinking that he was crazy, and he just wanted kind of that, you know, confirmation that he's not crazy, whether or not he actually wanted the treatment for the right reasons, maybe. But kind of what I was leaning towards is he's more focused on what other people are going to think of him and think that he's crazy.
Yeah, I agree with that as well.
And that's important. It's important for the nurse to like know that and keep that in mind, that she's dealing with someone who has a potential case of a social anxiety disorder, that it's even more so important to make sure that they're fully grasping what she's saying, because obviously, as stated before, he's in his own head and constantly overwhelmed by socializing in general. So he's even more so overwhelmed than the average like non-psych patient would be. So yeah, I agree with those points.
I think asking him too, like what is crazy to you, because like that's not really like
Yeah.
it could mean so many different things. So
Yeah, that's a good point. And just like again, like obviously we took mental health, and it's just like you just want to like your main goal is to investigate. So why are you so why do you feel like you're crazy? Like, so yeah, like asking questions like that. What do you mean by are you crazy? Okay. So quality of life, principles that promote quality of life are, wait, sorry, you guys keep blocking it. Okay. So the doctor continually reassured him that he wasn't crazy and that social anxiety is quite common. She emphasized that what he was experiencing is completely normal. And so this was effective therapeutic communication since it was relieving his anxiety and helping to decrease his embarrassment and self-consciousness of being different. So like what we were just talking about, she did like at some points use thorough therapeutic communication, but then there also were times it was lacking. So overall, like quality of life, it's him receiving treatment is going to positively impact his quality of life. Not receiving any treatment will negatively impact his quality of life. He was like very close to quitting his job, which would have led him even further into isolation, not even being exposed at all to other people. So that would have just progressively made his social anxiety even worse the less that you're exposed to social situations. And then working towards treating his social anxiety, things like forgot to put the citation for this, but I was reading a lot into exposure therapy for patients with social anxiety, and just working during therapy sessions, pretending you're in social situations, and over time, like helping you gain your confidence and like ability to withstand being in those situations. And then again, if needed, medications. So contextual features, principle of justice deals with equal rights of all patients. It's possible for even professional workers at times to be biased in decision-making. Dr. Tolgan may have treated Mo different since he was a psych patient. This may interfere with justice because he would be presented with information differently compared to someone who did not have a psych disorder. Also, there was not a lot of background info on the gene that she was testing for in terms of why it was indicated for him specifically. This made me question whether or not this was actually indicated or if she took it upon herself to test for it. Stigma is also a major factor that can interfere with justice. Mo likely didn't reach out for help earlier because of the stigma that surrounds mental health, and he made that like clear. And also his background with his uncle having schizophrenia, even more so emphasizing him to think he's crazy and be worried about being crazy, and believing his coworkers laugh at him. And overall stigma is just a common reason people don't seek and receive psych care. Lastly, blurred lines of communications. So the part about when she was stating that he doesn't have depression, so it'll be easier for them to treat not having the depression and whatever she said before. So that kind of just, like, as I said, like it would be better for her to just investigate more into that. Like, do you ever feel depressed? Not just jumping to conclusions that he isn't depressed based off the survey results and what's on paper. So my original perspective was Dr. Tolgan wanted to approach the situation from all angles. She obtained a full assessment and the genetic testing. She completely protected the patient's right to autonomy, and used good therapeutic communication. And then, like, looking more into it, my alternative perspective was genetic testing of this gene at this time wasn't completely appropriate, I guess. I don't know. As I said before, this like case study was kind of like, I found it difficult to work through, kind of, but it wasn't indicated. The provider did not ensure that the patient was competent to give informed consent. So overall, when I was researching this gene, there wasn't any strong evidence that indicated that having this gene suggests a severe mental condition. And in the case study, he was negative for the gene, so that ruled out all these severe medical conditions. There were a few studies that did show some associations between this gene and major depression as well as schizophrenia, but there's a lot that's still unknown about it. So she kind of, in my opinion, made it seem like that was like a big deciding factor on what the diagnosis was going to be, but then just looking more into it, it didn't really, the information I looked at didn't really match up with that, I guess. So I just was going to talk about what you guys' final thoughts, perspective on the care that Mo received was. Also, the fact that he didn't really show any additional signs of schizophrenia and all that.
I agree with you that the genetic testing was kind of inappropriate. Where I understand where she's coming from, and that's, maybe a route to go down later down the road.
Mhm.
I thought she maybe jumped the gun a little bit. And, didn't really take the time to do an in-depth assessment on the patient and his mental status and competency and all that. She just kind of jumped right to genetic testing before doing kind of your basic assessments on mental health first.
Yeah.
I also think so like I know he mentions that he's like they felt like this for like 8 months, I think it was. But usually like when like you have like a mental illness like kind of come on like that, like I feel like she should have asked like, did something happen? Was there like an event in your life that like caused you to start acting this way? Like I feel like social anxiety just doesn't really come out of nowhere. Like a lot of people like have it their whole life, but like I feel like I don't know. I thought that was maybe like something she should have asked him and maybe like dug a little deeper into like why he was feeling this way, instead of like Heather said, just jumping into like genetic testing and medications and things like that.
Good point.
Yeah, I agree. I don't know that the genetic testing was needed at that time. I think with the other cases that we've had, genetic testing seems like it was more appropriate because it might affect treatment options or it could affect other people in the family, but like nothing in this case was made clear that like knowing the results would really change his treatment plan. Especially because she could have sat there and really talked to him to see, what was going on. And the paper is really good, the surveys, but like they only do but so much. And even with the depression, she definitely should have talked to him. And I just from personal experience, like I know the depression surveys have different scales. So like it's hard to really say, oh, like you do not have it because, like you might have a low level or you might have a low grade that could change. So I think her doing that, since he already feels like he's crazy, if something were to change, that could maybe be really traumatic for him.
Yeah, I completely agree with that.
Kind of seems like she was able to do the genetic testing, get this negative result, and then answer that question, am I crazy for him? And I feel like maybe that's what kind of like prompted the genetic testing in the first place, is like this need to know whether he's like crazy or not. But it's like, even if you are crazy, like it's okay, we can work through it, and get you into like a healthier state.
I think the main concern is she was just worried about the family history of the schizophrenia. But again, he didn't really show any signs like other than that, like of schizophrenia. And also, I'm thinking of it now that he's 28, I'm pretty sure, and schizophrenia most often like will develop when you're, what is it, like early 20s, I don't know. So just like different factors, there wasn't really any indication for that testing, I guess. And then it can also test for, it could be linked to major depression, but there's many other, that's not the first line of diagnosis for major depression. So yeah, I agree with everything you guys said. And then so for the nursing provision, I thought this related to provision 1. The nurse practices with compassion, respect for inherent dignity, worth, and personal attributes of every person without prejudice. So the part of this provision I thought related to was provision 1.2. I didn't copy and paste the exact words, but nurses had the obligation to address behavior and offer opportunities to modify the behavior. So this just made me think of like how important it is to just keep in mind what and obviously she didn't come to a specific diagnosis at this point, but it was pretty like much shown that he was struggling with social anxiety. So keeping in mind that he has this social anxiety and like the root of his behaviors and how you're gonna treat this patient. And it's even more, as I said before, it's even more so important to make sure that he's understanding what you're saying, because he's already in a bad state of mind, having this social struggle while he's speaking to you. And so then working towards she might have had to work extra hard to get him to understand and show that he's understanding all of it, but doing that is like necessary to make sure that he's giving the correct informed consent and that he's fully understanding his treatment and options, which as I reread and again looked into it, I think that was lacking in some aspects. But overall, I don't think I think that she did, like, her care was in the best interest of him. But as we were all spoke about, jumping, doing the genetic testing might have been jumping to conclusions kind of and wasn't indicated. So that was kind of my conclusion. I realized right now that I didn't give a conclusion. So that's about it. Does anyone have any last final thoughts? Okay. Should I stop this? Okay.